Keyz. So Keyz, my name is Odelia, and I am in Nebraska, and we just legalized medical cannabis this past local election. I'm not gonna pretend that I know all the political talk because I definitely don't, but I did help collect signatures last year. It's my first year getting involved, and then since doing that, I want to do more. And now that it's medically legal, I want to be like one of the first nurses out there in Nebraska to say that I'm doing cannabis nursing. So
Mhm.
tell me a little bit about you. Excuse me.
Yeah, awesome. First, cool. Congratulations. I'm glad that you're getting into the cannabis nursing world. I'm actually new to it myself as well. I'm actually new to nursing. So I graduated from nursing school December of 2022, and then I got my license October of 23. So I am still pretty much a baby nurse, but I've been in birth work for almost 4 years now. And I actually got my start in both cannabis and birth work. I was working for San Joaquin County in Stockton, California. I actually worked at a substance use treatment facility. It was a residential facility, and it focused on pregnant women and women with small children. So a lot of them were there, working on their substance use. A lot of them had like CPS cases or drug court cases and stuff. So they were there not only getting help for substance use, but going through their pregnancy as well. So first, just watching them deal with that and cope with that. A lot of them shared with me that when they were out on the streets and using cannabis was one thing that helped them as a harm reduction technique, right? So instead of using like the fentanyl or the heroin or whatever, like sometimes just using cannabis was enough and it was safer and all this kind of stuff. So I was like, okay, that's interesting, right? And then the other part, a lot of them, when they were going into labor and going to give birth, they had no one there to support them, right? Like we as a staff couldn't stay there with them. A lot of them didn't have family support just because of everything that they were going through, and they were giving birth alone. And that like really like these were women that I was caring for every day, and just to have them go through that by themselves just really touched my heart. So that's what got me interested in becoming a doula, right? I always knew I wanted to be a nurse and work in birth in some capacity, but at the time I didn't have my nursing license yet, so I was like, how can I get into birth work? So that was a lovely introduction. So that's kind of how those two worlds kind of collided for me, right? Was working with these women who were in such this very special population, and seeing that cannabis was something that they were using as a harm reduction tool. So I was like, okay, there's something there. So then I started doing research, and then I came across. Are you familiar with like Dr. Rachel and Jessica Knox, like the Knox docs?
No, I can't say that I am,
Okay.
honestly, but I like how you just dove into like, the you niched down, like you saw something and that was just like, whoa, that's really tugging at my heart. I love that. It's just so
Good. Thank you. Thank you. Thank
amazing.
you.
Yeah.
So I found their work, and they kind of specialize in the endocannabinoid system, right? So I was like, okay, there's a real science. There's really something to learn here. So I just kind of like dove in. Even when I went to nursing school, like I made it apparent to even to my program, like, look, I'm interested in becoming like a cannabis nurse. I like cannabis science, so I would always like tie it into like projects I was doing and so you know what I mean, stuff like that.
Yeah,
So
that's awesome.
spent like my time in nursing school kind of having to teach myself because it wasn't part of our normal curriculum. So even for my last semester, I did an independent study, which I talked about. It was a final project. It was called Marijuana Mamas: Patients' Lived Experience of Cannabis Use in Pregnancy and Postpartum. And it was a literary analysis, just literally finding the research of not only patients' experience from like a qualitative point of view, but also like looking at the science of the endocannabinoid system and how it works. And just kind of making the point that as practitioners and providers, it's not our job to like punish or shame or blame patients, especially pregnant patients who come to us and tell us that they are consuming cannabis. Again, it's using those harm reduction techniques. How can we help them incorporate it safely and tailor to their needs and make sure that it's like actually working for the conditions that they're targeting? So that is kind of me in a big nutshell and how I kind of got into this work. So just meeting other cannabis nurses or others who kind of support or are interested in cannabis in birth work and in women's health. It's always great because sometimes I feel like I'm in an island by myself, especially talking about cannabis in pregnancy. I know it can get like kind of sensitive for some people. So I'm just trying to just share like just non-biased, non-judgmental, and just really like getting the information out there. Whether you choose to consume during pregnancy or not is completely your choice. But here is like the information that you need if you're going down that path. That's just kind of what
That's
I like to bring. Yeah.
that is so wonderful. I absolutely love that. So in doing your project, what were some of the things that you found like the most interesting when you were looking through the research, when it came to
um,
like pregnant women?
yeah, so I think the most interesting and kind of the point I was making is that cannabis itself, like the plant or any of its parts, is not as harmful as the stigma and shame that comes along with the cannabis use, right? It's the criminalization and the stigmatization of cannabis that is actually the risk and the danger during pregnancy, especially for women of color, specifically Black women, right? More likely to be reported, more likely to have interference from social services and things like that. So I think that yes, there's always the, oh, but we don't have the research, but we don't have research on anything for pregnant women ever, right? Like that's the ethics of
Right, right,
this,
yeah.
right? So, and we
We
already
don't
that
test
cannabis,
on them, yeah.
right? We do know that cannabis works for the conditions outside of pregnancy, right? So some of the common conditions that I focus on is pain, sleep, mental health, nutrition, and um, what's the last one? I'm missing one. It'll come to me. But we know that cannabis treats those things, right? Outside of pregnancy, right? We give it to people for appetite, right? We give it to people for generalized pain. We're working on it for like anxiety and depression. So what about being pregnant changes the efficacy of, you see what I'm saying? Like that's what I try to kind of demystify and destigmatize when I'm talking to my patients. Like we know and we are using cannabinoid therapies for these conditions outside of pregnancy. So now we just need to tailor it for pregnant patients, not exclude them from it, if that makes sense.
For sure.
Yeah.
Yeah, no, absolutely. Like, is your other one, was it nausea possibly or
Yes. Yes, it was. That's what I was like. I was
okay.
like, "Oh, there's another one. Yes. Nausea, vomiting, nutrition, pain, sleep, mental health. All things
Okay, cool.
I've been using cannabis for in other, in other patient populations. So again, it's just how do we do it for pregnant patients? Does that look more like a higher CBD to THC ratio? Definitely incorporating other methods of consumption. So I'm definitely big on like using topicals, transdermal patches, tinctures, things like that, not just focusing on inhalation.
Yeah, no, awesome. I think that's amazing. I personally, yeah, like you said, the research isn't there on humans for sure. Like we don't test, especially on pregnant women or, like children. Um, I I guess the only things we can use, excuse me, is like anecdotal evidence.
Mm-hmm.
I feel like I've known several women who would never admit to I continue to smoke, or continue to use cannabis while during pregnancy because it's the only thing that helps me with like hyperemesis, like vomiting all the time and then, gaining weight, making sure they eat, being exhausted. So it's like the one thing that they're like, and it's, like I'm not doing harm. I'm not taking like the pills, like Zofran or whatever. And I don't even know if they hand out Zofran like they used to, but when I
They
was
do. Yeah, they do.
yeah, like I was pregnant and I had Zofran all the time, and just thinking about how much I took, it just makes me sick to my stomach because it's so like harmful, and we just hand it out like, hey, this isn't bad. This is what we do. This is the norm. Um, and then, if something does go wrong, we don't ever really lead it back to unless it's something really significant. But like with Zofran, like the heart issues that it could cause with kids in utero, even in the women, it's causing damage to the child and the mom. And
Right.
knowing like what we know about the endocannabinoid system, right? Like it's the regulator of all the systems. How have we not like figured out how this is something that needs to be in all of healthcare? Like it's it's wild, but I feel like, do you just feel like a crazy person sometimes? You're like, how do people not understand?
Yeah, no, like I said, I feel like sometimes I'm just yelling out and, and no one is listening, or it's just like, again, just too niche for some people. Like, even in the cannabis world, I've had like some pushback when I say that I do this like in birth work, in pregnancy and postpartum. So even within the cannabis world, there's still a little bit of stigma when it comes to being,
Oh yeah.
using during pregnancy. But again, I'm not here to like say that you should or you shouldn't, but if you are, here's what you should know. And I just hope, like, in the same way that you are working with your midwife or your OB for, your physical care, you would work with your cannabis coach for your endocannabinoid care during your pregnancy.
Right.
Saying we're just part of the healthcare team, so like I said, like I'm just here to spread awareness, give education, and just be someone that patients can talk to, like, not, you know what I mean, just who understands cannabis, who understands the endocannabinoid system, and kind of help them focus and again make sure that they're using their cannabis in a way that's actually going to address, the conditions that they're looking at.
And what state are you in?
I'm in California, so it's a
Okay.
little easier for me.
Oh,
For
okay.
today.
You're in the state. Okay. Everyone's
I'm
like,
in
oh,
Sacramento, actually. I'm in the capital, so yeah, it's a
that's
lot easier to get stuff
awesome.
done.
So is it rare to find like a provider who's like, I don't know what the endocannabinoid system is? Because like I still go to appointments and I'm like, hey, I use cannabis to treat, all of my ailments. And, just recently I took myself off of my one last pill and, the nurse practitioner was like, do you really think that helps? I was like, what? I was like, let me tell you something about the endocannabinoid system. Have you heard about it? And she's like, no. And I'm just like, yeah, I guess we're not there yet. But is it rare to find somebody like that in
So
California?
so the practitioners like still don't know about the endocannabinoid system. However, cannabis is such a part of like just everyday life here that they're not as like strict or stringent, right? Like if you tell your midwife or your OB that I am using cannabis, they're usually not really, like, they're not going to report you. They're not, it's a lot women in like other states kind of that I'm trying to help right now, while like states like yours where you have a medical program but not a recreational program. So
Right.
what are the odds that if a patient becomes pregnant, they're either going to get dropped from their medical program or they're going to say that you're not a candidate for the medical program? And that's what I'm worried about. That was one of
Oh,
my
yeah.
biggest, like, one of my significant issues when I was doing my research project is that I feel like being pregnant is a basis for exclusion from medical programs, and that's limiting a patient's choice. That goes against patient sovereignty. It goes against, the emancipation of women's health, like that kind of thing, that reproductive justice of it all, right? So that's
Yeah.
kind of what I do. You know, like in Nebraska, like, are pregnant women eligible to become medical cannabis users?
No, I'm not sure, but that is a great question because I would hope so. I mean, I can't imagine. I'm like 43, okay, but every now and then I'm like, man, if I had another kid, there's just no way. Like, I think I could be able to do that without continuing my regimen that I use every day because of, my lupus and my, like I have lupus, but I don't want to say that. Like, I hate saying that I have that diagnosis, or maybe I'm in remission. A lot of people would say that, oh, you're in remission or whatever. And I haven't had like any flare-ups or anything, but this is the thing that keeps me functional. Like I can wake up in the morning, get out of bed. Like there are days where I'm so inflamed I can't get out of bed. So the fact that I consume cannabis the way I do to get out of bed, to and a lot of the times those side effects that I was having were caused by, like the medications that I was taking. I mean, they tried giving me Phenergan for like nausea because the, hydroxychloroquine was making me so sick to my stomach, but I can't function on that sort of thing. So I can't even imagine somebody trying to tell me like, yeah, you can use our medical program and you've been using it for lupus. And then like if I decide I want to have a kid, that they'd be like, we're gonna take that away from you. I feel like that's like a death sentence for somebody in my position, because you're basically telling me the thing that's keeping me functional alive, I can't use anymore. And I was taking 12 different pills to treat all of my symptoms when I just use different types of cannabinoids or figuring out what species or strains of plant is best for whatever I'm treating. So yeah, that sounds awful. I couldn't imagine if somebody were truly using cannabis to help. Well, I mean, everybody does. I feel like even if you're using it on a recreational level, you're using it to some capacity of treating yourself for something. So just taking that away from someone to that needs it to function and they're pregnant sounds evil.
Right. And so that's like where that's again where like the education and advocacy comes into place. Just like, yeah, this is a reproductive justice issue, right? We have the right to have children, to not have children, and to raise those children in healthy, sustainable environments. Like those are the pillars of reproductive justice. And I feel like cannabis comes into that because, again, limiting a patient's option based on their pregnancy or choice to have a family, it, goes against reproductive justice. And again, the criminalization and stigmatization creates those harmful environments where, right, it destroys families, it
Mhm.
destroys communities. So again, that's going against those kind of pillars of reproductive justice. So yeah, a little bit of science, a little bit of law, a little bit of holistic healing, and trying to roll that all into one. And that's kind of what my mission or my vision is.
That is so beautiful. I'm so excited for you. You have no idea. Like this is, we definitely need, cannabis care in women's health, like for sure. Just yeah, and I like how you're like the science. Yeah, the science for sure. I do like though, I am big on anecdotal
Mhm.
evidence as well, just because like we're not technically doing research on people. But have you found in other
Yeah, I mean
countries?
it's qualitative, right? It's like it's the patient experience. When I was doing my analysis, yeah, they were all qualitative studies, all of them kind of retrospective, right? I don't think nobody was like pregnant at the time when they were talking about their use or anything. It was like I said, it was kind of retrospective. But again, they did that, and then they did like cohort studies, right? Kind of looking at the long term like effects for children, I think like up to the age of 6, and there was no kind of statistical significance in the difference. They actually said that the biggest factors, which we always know, was maternal environment, right? What was her income level? What was her education level? Was she exposed to violence like in the home? Like those have a bigger impact on our pregnancy outcomes and childhood development than exposure to cannabinoids, right, in utero. Like
Right.
it's very little impact where it's really the maternal environment, right? Those communities that she's living in. That's what has the biggest impact. So just focusing on the bigger picture. Honestly, like I said, I think it's the criminalization and stigmatization of cannabis that is more dangerous than the plant or any of its parts, honestly.
Girl, yes. Preach, amen. Like seriously, yeah, for sure. What states are there states that are okay that with medical use, or are you finding more states will take away like a medical card if patients become pregnant? Um, have you looked into
So
that
I
sort
know
of
I
thing?
was reading like I want to say it was, of course, somewhere in the South, but they were just starting their medical program, and one of the like contingencies of their program is you had to submit a negative pregnancy test in order to be eligible for the program. And I was like, hmm. But what if my conditions
Wow.
are like what? What if I'm coming for like hyperemesis or postpartum depression or you know what I mean, like perinatal anxiety,
Yeah.
something like that. But yeah, that's when I was like, okay, we gotta we gotta address this immediately. um,
Yes.
yeah, I think I've gone on different like medical cards like online, and one of the questions usually is, "Are you pregnant?" or planning to become pregnant or something like that. And I always like, why are you asking? I've never gone all the way through, obviously, to the end, but just clicking through, like I've seen a couple that have asked, "Are you pregnant?" And I'm just like, interesting,
Yeah, like why does that matter? Yeah.
right?
Are you a female? Could you, like it's making it selective, I guess, no, for sure. I love this. I absolutely do. What are some of like the most awesome stories or like a beautiful story that you want to share about what maybe a patient that you were close to and I mean just kind of like I don't know, made you want to do this even more sort of thing. Like do you have like a story that just kind of pushed you to the edge,
Um,
like, hey, we got to do something other than, you were exposed and you were like, whoa, where's it more like, wow, I'm seeing this and this is wild. And like, it kind of like you said,
Yeah, I think it was so, like I said, when I was working for the county, I had a few pregnant patients that were on methadone. And obviously they, were dealing with opioid addiction outside of treatment, but they were using methadone and they just always said, like, I hate how it feels, I hate what it does to me. And then I had two patients who were kind of like on a higher dose, and when their babies were born, they did have a lot of complications. Babies were going through withdrawal, and they had this like immense amount of guilt about it. And I always want to address that with my patients is that guilt, right? So yeah, I think those were like the two stories that really got me. And those were two patients who had shared with me that when they were on the outside and they used cannabis, it usually helped them stop using opioids, even if it was for a period of time. Like when they were just exclusively using cannabis, it did help them stop the opioids. And they were like, the methadone just feels like using all over again. They still kind of had those same side of like making them very sleepy. They felt like loopy after for a while, and they were like, I know that this is not safe for my baby either. But they were like, I have to
yeah.
take it, right? Like this was their medicine. They had to take it, but they were like, I know that this is not safe for my baby. It was just dealing with that guilt, especially after baby was born and they had those complications. So I think that's what really got me interested in cannabis for harm reduction. Like, what does that look
Yeah.
like? And then again, just seeing my clients without support got me into like, okay, maybe I can try doula work just to get into the birth work world. I do eventually want to go to midwifery school and be like a midwife, and focus kind of on, of course, physical health, but like maternal mental health as well, ensuring that my patients are kind of seamlessly transitioning into that role as parents. And if they're using cannabis, again, what does that look like, to support their mental health?
God, I would have loved to be able to have used cannabis during my pregnancy. I had hyperemesis so terrible. And the postpartum depression was awful. I've never ever felt homicidal ever in my life until I was postpartum and I wanted to like murder my husband, like for real at the time. I was just like, I hate you so much. Like in, I had a visiting nurses association lady, a nurse come in and weigh my kid because I was nursing and stuff. And she would ask me like, are you having any thoughts of harming others or yourself? And I'm like, yeah, I want to harm my husband, like legit. And then I'd be like, haha, I'm just kidding. But like I like for real too. And she was like, okay, and was very dismissive about it. But like I wish it was okay to say, hey, like your hormones are so fucked up that yeah, you might feel not like yourself. I mean, your whole body just changed. You just brought a soul into the world. Like, of course, I feel like your body's gonna go through all these crazy chemical changes and hormonal changes. But yeah, I think that is also a huge too, tying that into it, like postpartum. Um, if that's the thing that's helping you. I mean, I sure wish I would have had, because I was on like some SSRI, I want to say Lexapro, uh,
Mm.
and I still felt like I wanted to murder my husband, like, so it just wasn't helping. What do you hope for the future to be for cannabis in women's health? Do you want it only to be a harm reduction, or do you think in the future there's going to be more, hopefully, more ways that we can use cannabis
I
for?
no, I definitely think that it's going to be able to like treat conditions. I know there's like emerging research for like endometriosis, PCOS, things like that. We already know that it can be used to like help prevent different cancers, hopefully like breast cancer, ovarian cancer, kind of the female body specific cancers. We can like do more research in that for sure. But specifically in like pregnancy and postpartum, definitely for hyperemesis. And then if not just not cannabis alone, but really targeting the endocannabinoid system as a whole to treat perinatal mood disorders. I think that's something that I really want to focus on in my practice is like healing the entire, like whether that's through movement, breath work, proper nutrition, like really like bolstering our endocannabinoid system to hopefully prevent or to treat perinatal mood disorder. I think that is kind of where I would like it to go, hopefully. It sounds expensive. That sounds like a lot of research dollars that I would need, but but I think that's like something that I could definitely get into.
No, that would be so okay. When you say perinatal, is that like right before you get pregnant or like during? Like this
So
sounds. I'm a
perinatal,
nurse and I should know this, right? But I'm like, I don't deal with any kind of babies or vaginas, like
no,
old
it's
people and
so
death.
perinatal is from the moment of conception
Okay.
to the first year of life.
Okay.
So that's the perinatal period.
Yeah, no, for sure. Cannabis, I think would have definitely helped. Or, supplementing my endocannabinoid system, knowing what that was, taking time for yourself. Like when you're sitting there with your baby and you're like peeing on the toilet and you're nursing your kid because we're just like,
And you're all everywhere. So yeah, like I said, just targeting the endocannabinoid system as a whole to be able to focus in on yeah, mental health during that perinatal period. So
yeah,
conception all the
absolutely.
way until baby is 1 year old.
Yeah, no, I love that. I would have loved something like that. You do have like the people there, like I had a lactation consultant, I had my OBGYN. I had a nurse practitioner who asked me how long I was going to breastfeed for. How long do you plan on doing this for? Because he was trying to prescribe me something. And I was like, until at least a year at least.
Yeah.
But
Hmm.
having people that I hope it's not like that anymore because my kid's 16 years old now. I feel like people are more open to helping you, do things more naturally, like breastfeed, do things type thing, or even just do what you want to do or what your wishes are and kind of help you follow through that is like you said, we need to be like non-judgmental and provide the education and not say, hey, this is what you should and shouldn't do. Or yeah, I definitely love that. People need to have the awareness or and the education of all the modalities that are out there. And like you said, not just cannabis to supplement the endocannabinoid system, like, being outside or singing, doing something you love, Yeah.
Hmm.
Yeah,
Absolutely.
that's awesome. Yeah, I'm so super excited for you. I just want to say thank you so much. This is great. I would love to hear more, like and what your plans are and what you're doing. Like you said, you've been a nurse for 2 years. That's wild. You're amazing.
Thank you. Yeah, I'm still a new nurse, and like I said, I do eventually want to go back to get my DNP for midwifery, but I'm giving myself some time. I got some work to do for sure. Yeah, I'm still growing my doula practice and working in here in Sacramento, servicing our families here. I just hit the 1 year mark at the hospital that I'm working at. So yeah, I got time.
So do you have your own doula program? Were you or is it like a doula program that you're doing to become or you're
So,
already a doula,
so,
right?
so I'm
Okay.
yes, I'm already a certified. I'm a full spectrum doula, and I have like my own kind of private practice. I see clients on my own, but I'm also part of a doula collective here in Sacramento called Haven for Birth. So we work in teams and basically just do birth, postpartum work. We host lactation classes, perinatal yoga, all that good stuff.
That's awesome. I love that. Yes. Okay. You're doing all the things. So, Keyz, thank you so much for coming on here and talking about all the amazing things that you're doing, especially with women and pregnant women and just perinatal care. I love it. I'm so excited for you. Thank you for sharing. I'm so honored. Where can people find you if they're looking for you?
Yes, so they can find me at the Indie Women's Club, and Indie is spelled INDI, the Indie Women's Club, Facebook as well as Instagram, LinkedIn, and yeah, hopefully more podcast episodes. So yeah, I
Yes,
look forward to connecting with everyone, and thank you again so much for chatting with me. This has been amazing.
girl. Yes, likewise. All right.